Hi everyone, good afternoon and welcome to today's Facebook Live session. My name is Zoë Clark, I'm Senior Self-Management Programme Officer here at NASS, and I'm very happy today to be joined by Ian Appleyard, who is Research and Policy Manager at the British Acupuncture Council. Hi Ian, thanks for joining us. How are you today?
I'm fine, thank you, and thank you. It's a real pleasure to be here, although obviously we're all in different places, but it's nice to be on the stream. Yeah.
So thanks so much. I think based on the number of questions we got in before the session, I think it's going to be a popular one.
Right, thank you. Okay, shall I just let you know a little bit about myself? So as Zoe says, my name is Ian Appleyard. I'm the Research and Policy Manager at the British Acupuncture Council. So I've been involved in acupuncture for approaching 30 years or so now. So I was initially I was a practicing acupuncturist, and I decided I wanted to know some more. So I went to China, and I lived in China for about 3.5 years, worked in some hospitals there, mostly in Shanghai, but also in Nanjing. And then I came back and I started practicing again in private practice, and also moved into education. And I taught at a place called the Northern College of Acupuncture. And then in 2008, I became course director at a university, London South Bank University, and I was course director there for a decade or so. And now I've moved into the research elements. I did a PhD, which was on acupuncture and osteoarthritis of the knee. And so now I'm working as the Research and Policy Manager at British Acupuncture Council.
Oh, fantastic. Thank you. There's lots of strings to your bow there.
Yes.
And I can see we've got a few people already joining us. So thanks everyone for joining us. And please do share your experiences of acupuncture in the comments, because it'll be really interesting for us to see how people have found it for helping them manage their pain. And as always, this video will stay on our page afterwards, and we'll also upload it onto our My AS My Life webpage and YouTube as well. So if you can't join us for the whole session, please do check back and you can watch the whole session back afterwards. And please do ask your questions in the comments as well. I've got a few prepared that we'll chat through, but then afterwards I'll make sure to check back on the comments and answer any of your burning questions as well. So firstly, Ian, I guess a good place we could start really for anyone who's unfamiliar with acupuncture. Do you want to just kind of let us know what it is and what it involves?
Yeah, okay. I think most people will know, just regardless of how familiar you are or not, is that it involves needles. And it's also quite well known that it comes initially from China. The actual origins of it are not 100% clear, but we think it started around 200 years in BCE. Not necessarily initially with needles, but with sharp bones and stones. And it was in China, and then it spread to Japan and to Korea and Indonesia and other places. And sort of why that is important is because there are different styles of acupuncture. So we can categorize them in two broad things. One is the traditional styles, and the other is the more modern, let's say, or what's called biomedical or Western medical acupuncture. So in the traditional styles, it's not just one thing. You've got Japanese acupuncture, Korean acupuncture, Vietnamese acupuncture, and then different breeds within the Chinese tradition. So that can mean that when you go and experience acupuncture, you have slightly different experiences. So one practitioner might put a lot of, not a lot, but maybe 10 needles in, whereas another one might concentrate to 3 or 4 specific points that they're interested in. And they can, particularly from Japan, they will just put the needles in very shallowly and have a very light feel, whereas the more standard Chinese at the moment, they put the needle in a bit deeper and you get more of this achy sensation. Beyond that, I would say in Chinese, the word for acupuncture is zhenjiao, and zhen means needle, jiao means moxibustion, which is quite important. Actually, going back in time, the points, the acupuncture points at specific places on the body were initially stimulated primarily with moxibustion. So it's the moxibustion that was sort of more important than the needles 2,000 years ago. And that will normally only be used by traditional acupuncturists rather than the medical acupuncturists or biomedical acupuncturists in the UK. And I think I wanted to highlight that for people with AS is because when I've looked at research, most of it's done in China, and nearly always they feel that moxibustion is key in treatment for the research. So there's different ways to do the moxa, again, depending on your traditional style, but a lot of the research is done is not just the needles, but moxibustion too. There are a few other what are called adjacent techniques like cupping and Twain-arm massage and things like that. And then some acupuncturists that also offer dietary therapy. So you can have acupuncture where the points are selected using the traditional theory, which involves yin-yang and other things. Or you can have acupuncture where the points are selected a little bit sort of retrospectively, if you like, is that Western science has understood that certain points do certain things and they concentrate on those. So it's a bit more, they probably wouldn't like me for saying it, but more simplified in some ways. But there is these kind of broad differences. But of course, people who are doctors who've studied acupuncture sometimes start learning more and more about the tradition and spread what they do. And others who are traditional acupuncturists know about Western medicine. So simple answer is having needles put in your body, but in the long term, there's all these theories and ideas to say what strictly is acupuncture.
Gosh, that's fascinating. I knew there were some varieties, but I didn't realize it was quite that sort of broad. So it was really interesting. Yeah, really interesting to get an overview. I imagine we could probably spend a few hours just talking about that, probably, couldn't we?
Yeah, I think it's important that some people say, well, I had acupuncture, it was like this, but sometimes it's a bit different. It might just be what can be called dry needling. As I was telling me, sometimes people are in the States who listen to this, and different states within America have different legal requirements about who calls themselves an acupuncturist and who calls themselves a dry needler. In the UK, we don't have such clear divisions as a rule.
Okay. And actually in that overview, you mentioned how you can sometimes get an achy feeling when the needles are in place. And we had someone asking beforehand, before the session, about how sometimes when they've had acupuncture, they've not felt the needles before, at all. And sometimes they can feel like a stinging or a burning sensation. You mentioned that could be due to the depth of the needles. Is there any other sort of effect that can cause that?
Yeah, I mean, it's a big area of debate. In Chinese, it's called qi, which is sort of arriving qi or whatever, coming qi. Can be translated a number of ways, but this kind of aching and tingling. So most acupuncturists, I would say, who train traditionally, and most medical acupuncturists want to achieve this aching sensation. They feel that the qi, if you like, is there and they're stimulating the point. Whereas some acupuncturists actually actively try to avoid it. In my experience, it's you can't necessarily avoid it because sometimes it just happens. You don't really have to do anything to get this sensation. But in the most common clinical practice, people will actually sort of lift and reinsert the needle very slightly. We're just talking a couple of millimeters up and down, or they turn it to try and get this sensation going. So you get an ache, and they feel that getting that sensation is going to be more therapeutic. Now, whether you feel it or not also depends somewhat on you as a person and maybe as a particular day. So there's definitely some people who are, let's say, super sensitive in feeling the qi, and you put a needle in and they say, oh, wow, I can feel that. And I've had people explain to me they can actually put the needle in and then they describe the the meridians, I probably should have said, but in the tradition, there's 12 meridians around the body, these lines, which most of the points sit on. And some people, you put the needle in and they can feel the sensation moving along the meridian. So I certainly had some people, I put a needle in their foot and they've been able to describe the entire meridian all the way up to their head from the sensation, which was for me, very interesting indeed. But then some people just don't feel it. It doesn't mean that you won't get any benefit. It just means that you can't feel it. It's not like people know from research which is the best, but people tend to think, most acupuncturists say some sensation is better. And you can get a stronger sensation by needling it slightly deeper or slightly more shallow. So it's kind of getting on the spot, I should say.
Okay, so it sounds very kind of individualized whether you get that response or not. And
it is, yeah. And just sometimes it's a natural medicine, I suppose. It's kind of skill of the practitioner. And maybe sometimes they don't get it right on the point. The points, in my opinion, they move around a little bit. The anatomical descriptions just tell you roughly where to go, but then you have to sort of put it on the point. And then just like a football player, a golf player, or a musician or whatever, sometimes the acupuncturist is on form and gets all the points right, and sometimes they're not, so you don't tend to feel it. So it's a mixed, there's a lot of complexity there.
Oh, that's interesting. I think for our viewer who asked that question, I think that'd be really helpful. Certainly in terms of knowing that even if you don't feel the needles, it doesn't mean there's no effect.
Yeah.
Wonderful. And I mean, today we were discussing a little bit about how you can manage pain by using acupuncture. That's a very broad question, but do you want to tell us a little bit about that?
Well, I think one of the blessings, if you like, for acupuncturists is the traditional concept of pain is very simple. So we have this idea of qi. Now, obviously, qi is a controversial word. You may have heard of it, and sometimes it's translated as energy. I don't think that's a good translation. But to give a sense of what is qi, the Chinese for anger is sheng qi, which means growing, expanding qi. And if you think of a cartoon, Tom and Jerry or whatever, and somebody gets angry and their head actually gets bigger and bigger and goes red, that's a description of sheng qi, that qi all moving up. And similarly, disappointment is xie qi, which means going down. So it's this kind of almost cartoon character-like motion, or how we see small children reacting to things. That's what qi is to some extent. So you shouldn't think, oh, there is no such thing as qi. But if you think about the anger, we all know that anger exists. But of course, you can look at it in a sort of biomedical, physical way and think about heart rate and all the adrenaline, whatever, that's been stimulated. But the qi moves up. So this is what what we mean by qi. And in health, qi should be moving around freely. If it gets blocked, you will feel pain. So that's it. It just means that the qi is blocked. So from the acupuncturist point of view, the main thing to find out is, where is it painful? Because then you know where the blockage is, and you can use normally local points to that area, but then points spread along the meridian. So as simple as like a traffic jam or something, you know that you've got to move traffic on from a particular place, but you might want to sort of help spread out further down the road to get things flowing, literally flowing more easily. So in that respect, treating pain is, I wouldn't say it was easy, but you don't have the complexity of trying to understand the so-called cause. So whether there's something that can be like MRI scan, whether it's there or it isn't there, The key element is where the person who's got the pain says the pain is and where it spreads. The acupuncturist might palpate certain points along the meridian, which the person didn't realize was painful, but on pressure, they find, oh, that's tender. And all of that is information for the acupuncturist. So I think acupuncture is probably best known for treating pain, and it might be because of this kind of element of, we have a very, we're not withheld by, oh, what's the sort of biological mechanism underneath. We just need to know where the pain is. And that's not to say it doesn't make a difference whether there's tissue changes. It probably does, but we don't know for absolute sure.
That's interesting. I suppose for a condition like axial SpA, where the pain often moves around and it can be quite unpredictable and affect people very differently day to day, it sounds like it works really well in that sense, because it's going to depend on the day when you're seeing the practitioner.
Yeah, and when we look at these painful syndromes, whether the pain moves around a lot is like a symptom. It sounds very strange, but with traditional practice, that means this wind is a problem, and that means you can track the pain with the needles that you do, but you can also try to use other points, kind of systemic points, to help solve that problem. Whereas other people who've got like a fixed pain always in the same joint, you can use the local points, meridian points, but then you can put in a few other points to try and help what we would call cold. So it all comes from way back in the day, where they were using analogies from the weather, because that was their lives. A little bit like in modern medicine, talk about programmed cell death and things like that. Of course, no one's going around programming cells. There's no little Bill Gates cell going around programming cells, but we use things from our society to explain what's going on in the body. Or people talk about the brain wiring. The brain is not wired, but we use that as an analogy. And back in Han Dynasty China, they used the weather and their empire. So there's words like ditches and grain houses and things like that to try and explain what they thought was going on.
Oh, I do like the idea that we could just program the cells. That sounds like it would be quite easy, doesn't it?
That's right.
If only it was.
Reprogram.
Yeah.
Okay.
And so for anyone who's watching who's had acupuncture before and found it beneficial, I know obviously some people find that the effects wear off. Is there any way that you can kind of prolong the effect to make it last longer?
Yeah, I think so. I think I tend to feel in that try not to be overly sort of science and research based. I know there's a lot of people listening, but in the way science at the moment measures, tries to understand, you probably know it's randomized controlled trials. And they're sort of, you have an intervention, you kind of see what happens 6 months later or whatever. But in actual practice for acupuncture, and I think for many other healthcare professions, it's much more, treatment can be much more drawn out. So what I find for lots of pain conditions, one thing that stops the body being in pain is movement. So the acupuncture reduces the pain, and that allows more movement. And then the movement itself is part of that self-maintenance. So it's about getting a virtuous cycle, really, of getting a bit of movement and pain and allowing the movement itself to help. And that, obviously, in practice, we'll see a lot more people with osteoarthritis, for example, than AS and stuff like other more sort of, let's say, specific conditions. The more general aches and pains will come because there's more people around with them. But that's what we see from osteoarthritis, it can be quite common that you want to kind of get the right balance between increasing the level of movement. So sometimes you can treat people for knee pain, they get a lot of benefit, and then they go out and play around a golf or something, and then they have a bit of a relapse because they've done too much. So it's about getting a balance. So rather than seeing, we know from clinical research that for back pain, knee pain, shoulder pain, that you can have a course of about 10 weeks acupuncture, and the benefits will last more or less for up to a year. That's from big systematic review. But I think it's not that the body is necessarily still getting the direct effects of the acupuncture a year later. What that course of acupuncture will set somebody up to do more and to live their lives in a sort of sense. So there's kind of, we are, by moving around, doing our own maintenance work basically, and that's getting the balance. And sometimes it's important for people to have a course of treatment and then go back for a short course to sort of don't allow themselves to go down, and kind of see it as a let's say the treatment across a time span, whereas most clinical trials see it as like a little snapshot, and then we'll see what it's like 2 years down the line. But it's more, there's so much more going on. So you get treated, you move around, and hopefully you feel better, and you feel better, and therefore you move around more, and then you get, so it's about virtuous spiraling up rather than spiraling down, I guess.
Absolutely, and that's music to our ears here at NASS, because that's one of the best things you can do for axial SpA is to keep moving. But obviously, if someone's in the middle of a flare-up and they're in lots of pain and they're not able to move, as you say, you're in the opposite, you're in that kind of vicious cycle of moving less, then you stiffen up. And so if you can use something like this to help lift you out of that and get you moving more, it's going to help everything overall. That's wonderful. And I'm keeping an eye on the questions as they come in, so I will go back to those for everyone who's popping their questions in. Please do keep adding those. Again, from the post before this session, we did have a few people sharing their experiences, so thanks if you're watching, if you shared your experiences. So we had one person saying that after acupuncture they feel like a slightly clouded feeling in their mind, and someone else shared that they've had sort of short periods of increased pain after a session. Do you want to sort of chat about that at all, sort of those kind of effects?
Yeah, I mean, the easiest one, I suppose, is short period of increased pain. If we go back to this notion of like a blockage, and basically what you're trying to do is get the chi to move along the channel and push the blockage out the way and get flowing. Sometimes the blockage is strong and you're pushing a lot, and that increases pain, if you see what I mean. So there can be that. Hopefully that push releases the blockage and things get much better. The most stark example I have from my own clinical experience, I treated somebody for tennis elbow. She came in and she had one treatment and she went away, and it was fine. I just thought, standard, we're going to take 3 or 4 treatments and she should be on her way. And she came back the next time and she said, I've only come back to thank you, but I was so close to putting in a complaint the day after, because she'd gone away and her elbow had become incredibly painful. She'd actually paid to go, especially to go to the opera in London. So she had splashed out to go spend a night in a hotel and go to the opera. And she said she couldn't enjoy the opera at all because her elbow was painful and it swelled up. She described it to be the size of half a cherry, red on her elbow. But she said the next morning it had gone and the pain had completely gone. And she'd had this pain for a number of years prior to that, and nothing had been able to help it. And so 2 days after the treatment, she was absolutely pain-free. And then she came back just to have one more treatment and tell me the story. So I never expected something like that to happen. But the way she described it certainly seems of this kind of big push and then move that quite, resistant blockage, and then it moved on. So it could have gone badly, I suppose. She might not have got completely better. So for the practitioner, they also have to try and judge the person. Same like doing too much walking around and overdoing it. Sometimes you can overdo the acupuncture. The body can only, in a natural way, can only sort of go back to where it wants to be, if you like, in stages. It's, if people just say you're stiff and stretch, you can't stretch, touch your toes or whatever, even if you have no diagnosis as to why that should be the case, you just sit in front of the computer too long or whatever. You have to, if you're going to do your yoga class, to sort of remedy that. It doesn't mean you just do one session of yoga and somebody yanks your arms to your toes and you can get away with that. It has to be done in a gradual, sustained way, because your tendons can't suddenly change their length, but if you can stretch them 2 millimeters a week or however long you do, then over the course of a month you can get greater flexibility. So the practice of acupuncture is a bit like that. Is you don't want to be overdoing it, you don't want to underdo it. You kind of find the Goldilocks amount of treatment, and that can be number of needles that you use, how much stimulation, how strong qi, how much mox you use, and all of these things. Do you use cupping, how long you leave the needles in for? All of these can make the treatment a bit stronger or a bit weaker.
Okay, and it sounds like maybe to be on the safe side, try not to plan anything too major for the day after, just in case.
Yeah, I think so. I think you have to, the key, and this is probably a key for life, full stop, but just to gauge what's right for you, because this is the whole thing of what we call holistic, individualized form of medicine. What is right for that person? So it's kind of helpful if you've had a treatment not to be forced into doing a specific activity a lot. The next day you have the capacity to stop if it's too much.
That's really helpful to know. And I know that in the run-up to these sessions, we had lots of comments about sort of accessing acupuncture as well, particularly through the NHS. We did have one person share, Jeff shared that he had acupuncture at the Royal London Hospital for Integrated Medicine. Yeah. Do you have any advice for anyone trying to access acupuncture on the NHS, particularly for that kind of long-term pain management?
Yeah, I mean, the challenge is obviously, and I think came through on the question because we've got new nice guidelines for primary chronic pain, which includes acupuncture. And actually next week I'm having a meeting with Mike Cummings, who works at that hospital, because what we want to do is the acupuncture organisations, the British Medical Acupuncture Society, the Acupuncture Association of Chartered Physios, and ourselves kind of get together and try and find GPs and clinical commissioning groups to start using acupuncture. Now, obviously, there's not necessarily a lot of money around in the public purse at the moment. So, although it's in the guidelines, I think for many, either GPs don't realise that it's in the guidelines, but they certainly don't have a budget to actually prescribe it. So there is an amount of advocacy work that we need to do to get there. So, and I was just thinking about this question, and I don't know, I will put it to the other groups of whether or not we come to work, not necessarily work collectively with charities like yourselves to sort of, when we're putting forward the case to various GPs or whoever, just say, well, these charities would be interested, their members would be interested in accessing things, so that the service providers themselves know that there is the patient desire really to at least try and have some benefit. So I don't know whether that's possible. It was just something I thought. No one else knows about this yet, so I'll have to check with the other people who run the BAXC and the other groups. But it just occurred to me because what we will be doing as like the 3 acupuncture organisations is asking our members to try and touch base with GP surgeries. As we understand, the best people in GP surgeries to get in contact with is actually the practice manager rather than the GPs themselves. So that's one, and again, it's kind of to find who's doing the administrative duty, I suppose. I think even if you don't have individual success, it's still worth to knock on the door and say you might get lucky. You might have a GP who's really thinks this is good. I mean, there's some projects have run which have shown actually to be beneficial for the surgery's overall finances, because this is it's a general pain normally, but reducing the medication bill and things like that can be quite useful, and reducing time when people are seeing their GPs because they're seeing the acupuncturist that frees the GP up to do other things. So I think for the individuals, get in touch with your surgery, go to the practice manager. If you want support in that, then let us know as British Acupuncture Council. We could probably, basically, if you feel when you put the fishing rod in the water, if you feel you're getting a little bit of a bite, then we can come along and give a presentation to the practice and say this, and maybe find a few BAXC members who'd be willing to be involved. It will probably require them to, I think in the initial phases, it's going to take a certain amount of voluntary work on the acupuncturist's part. But if a GP's surgery has got space, and whether it's done on donations or however it works out, it'll be done on a local basis. But I know it can be difficult, even though it's in the guidelines. It's in the guidelines for migraines too. It's very difficult to actually access that service, unfortunately.
That's it. And I know it can be hard for GPs to kind of keep up with the guideline changes as well, can't it? So it takes that time to trickle down.
Yeah, it's hard for them to keep up, but also because there's no, and I think this is, it's kind of written between the lines of the latest guidelines. It's kind of, we're going to recommend this, but we're not really, there's no framework for funding it and delivering it, basically, because acupuncturists is not very seldom within sort of the mainstream NHS. So I think the guidelines sort of have a nod to that. We are saying this, but actually we're also kind of aware that it doesn't necessarily mean anything on the ground. So I would say it is for acupuncturists, but also for people who want to access service to collaborate as much as possible. GP practices, let them know that they would like, you would like them to have acupuncture service. And then if people are writing in for their migraines for the same thing, and the practice manager is getting a number of these letters, and then an acupuncturist comes on and say, would you like to work with me? Then they might be more sympathetic to it. And I'm sure there will. Somewhere in the country this is going to happen. And it's about, on a local basis, to make it happen. And you can also write to your GP, not your GPs, your MPs, and speak to them and let them know what you need, really, because on paper we are, the health service is meant to be patient-centered. So whether it is or not in practice is, probably a debated point. But that's, if the more people know who've got, some influence, then the better.
That's really helpful, and yeah, certainly really, really helpful for people if they can get in contact with you as well for a bit of support if they do get that sort of positive response. So we've shared the organisation details in the video description. So if anyone wants to visit the website, you can head there. I have seen out of the corner of my eye, we've got a question, quite a specific question from Rachel, asking if acupuncture is safe for people on biologic therapy, the immunosuppressive therapy, as it breaks the skin. That's a good question.
Yeah, I mean, obviously we have, for a variety of reasons, people that come through who are immunosuppressed. I mean, this includes people with cancer and other people, people with rheumatoid arthritis, and they're taking specific medications, same reason. So in this case, I would always say it is very important that you do speak to your GP or whoever is actually prescribing the medication. Tell them what you would like to do and give them a judgment. It is possible. We do it all the time, I should say. We will, I mean, I would say we're probably a bit more careful, but a shallower needling can be things, so you don't go too deep. You can wipe with an alcohol swab the point directly before. So in a sort of, let's say, somebody without any kind of immunocompromised status, you can put it, all acupuncture needles should be single-use sterile anyway. So you can put the needle in and they'll be fine. So you also have to bear in mind, I guess, the comparison sometimes, because you're in a medical setting, there's a particular sense of, oh, we must do no wrong, do no harm. That's the first point. But you'll get a sterile needle inserted, hopefully by someone who's properly trained and has washed their hands. And they don't even touch the shaft of the needle, because normally the needle's in a tube, guide tube to tap it. So that, on the sort of logic, can't be any more risk than cutting yourself on a page of the library book or something. Do you see what I mean? It's going to be a lot safer than a day-to-day cut, I would say. But obviously we feel a bit more, no acupuncturist is going to want to have a person get an infected point or anything like that. It's very rare. I mean, there are, if I can remember the figures, in Germany, they did a lot of acupuncture research for neck pain, back pain, etc., and knee pain. And one thing that they did was also a sort of a forward-looking prospective study, which is better science. Basically, you set out and you monitor how many adverse events there were. So out of 2 million plus treatments, I think the skin infections are down in the 10 or 12, yeah, something, or maybe 30. It's not 100. So you get and many of those that didn't need further treatment, maybe just a bit of monitoring and stuff. It doesn't become something that's permanent. It's not permanent damage. It's not to say it can't happen ever, of course, because it's penetrating the skin. But single-use sterile needle, someone's washed their hands, you compare that to a day-to-day cut, you'll see the level of risk is much lower. And they're very small needles, so they're smaller than, you're going to be at greater risk, I suppose, from having a jab because of the bore size of the needle and stuff. It's going to be more damage. So you can do it, but it's always definitely worth speaking to your prescribing the medication, just to talk it through with them. Certainly from treating people with cancer, that's important because their level of immunocompromised does fluctuate with where they are in their course of treatment. So sometimes you just think it's a cost benefit, you know, just maybe at this period of time you don't have acupuncture, be super careful, but then when your, you know, white blood cells pick up again, then you go off and have your acupuncture and then feel better, etc., etc. But generally speaking, as long as you're being treated by someone who's fully trained, so British Medical Acupuncture Society, AACP, ourselves, then you should have a very hygienic treatment, and the risk is pretty. I don't know whether there are a few sort of case reports of infections, but there's globally, this is, so there's quite a lot of people having acupuncture. It's a very small proportion.
That's really reassuring. And is it across the UK that acupuncturists all have a license from their local council as well, where they've inspected the premises as well? Is that everywhere?
Yeah, that's right. I mean, all local authorities have the power to say no to an acupuncturist practicing there. And some local authorities, particularly in London, they don't, for BACC, British Acupuncture Council member, they don't come necessarily inspect. We just tell them that we're there. So we don't have the same, we don't have to go through the application process or pay the fee. But outside London, there's normally that case. But you should, if you're considering it, just double check with the practitioner. They should be able to prove that they've got a license, that they're insured, that they're trained, etc. And they're on the register. So we've got our register, the BMAS has got theirs, AACP have got theirs. Yeah.
It gives you that peace of mind then.
Yeah, absolutely. And we're sort of regulated through the Professional Standards Authority. So which is an organised government, non-governmental, but it's effectively the state that looks at all statutory regulated bodies like Nursing Midwifery Council, but it also keeps an eye on certain complementary medicines, and BACC is the only one that does acupuncture in that category. Oh, an accredited register.
Oh, wonderful.
Which technically also means that a GP can refer you to a BACC member. They don't have to refer you to a GP that practices acupuncture, who quite often won't have the time to see you. So,
that's helpful to know. So can people search the register on there to find if there's someone local to them, do you know?
That's right. So the best way to search is to go onto our website, and there's a find a practitioner, and generally we'd always recommend put in your postcode, and that can give you a certain radius. I mean, you will know your locality and what's easy for you to get to if you're going to go on the bus or a train or whatever. But then you should be able to find someone reasonably close. And I would always recommend, first you want to feel comfortable with that person. So give them a call, talk to them, even look at their website. I think that will give you a feel for, as Zoe and I were talking just before about, there's quite a spectrum of, say, ideologies. Some acupuncturists are quite medically minded, some are more traditionally minded, and different practitioners may suit you people as individuals. You might like a particular style. So you have a chance to speak to them, feel comfortable, but also be reasonably convenient for you, because I think most people with AS, one treatment's not going to do it. You are going to have a course of treatment, and you might need to pop back from time to time to really feel benefit. So you don't want to be sort of thinking you're going to get a 50-mile journey for one treatment, then get back. And so
that's really helpful to know. So I think we have one other comment from Robin, who shared his experience. I think and that was earlier on when we were chatting, because he said that he did find acupuncture really helpful for his back pain. But obviously, because of his chronic back pain, he sort of needs that ongoing treatment. So hopefully, some of the advice here will be really helpful in terms of accessing more ongoing treatment, hopefully through his GP. And we've just got a question from Jane. She's asked, do we, the person going to an acupuncturist, supply their own needles, or does the practitioner supply and clean them, or are they disposable? She's not had acupuncture before, so she's interested in that.
I'll say something. I just say something about people who are looking to access treatment. There's going to be a period of time before it fully becomes on the NHS, I would say. So if you want some benefit tomorrow or next week, you might, when you go to the find a practitioner function, if you have a look at a number of websites, you might find somebody's doing or working as part of a multi-bed clinic. So these are set up probably in the last 10, 15 years, depending where you are in the country, you might have access to this. So if you're in sort of bigger town or sort of more alternative minded place where there's a lot of complementary therapy, you might be able to get a multi-bed, which normally brings down the cost. That's why they're set up. So for people having ongoing treatment, they can be quite, you lose, the sort of privacy one-to-one element, but you gain in not spending so much money, and you might like the support and to feel that you're at a place there. Certainly when I worked in some clinics in China, they had a really good atmosphere. It might be 8 couches in one room and people are all talking. We didn't have this kind of quiet, many one-to-one treatments, quite quiet and almost reverential, but the sort of grandkids would be coming in and they'd probably be talking. So a multi-bed might suit you. But to go back to the needles, the acupuncturist will purchase the needles. Normally, good suppliers normally ask that you've qualified as an acupuncturist before they actually sell the needles. So they should be single-use, sterile, and then with a guide tube. It's not necessarily, it depends, some are short, you don't absolutely have to have a guide tube, but for most people there'll be a guide tube. If you're concerned, and we should understand some people, especially if you are immunocompromised in any way, particularly concerned, you can say that to the practitioner and they should be more than happy to show you the needles pre-packed and open them in front of you. So you can see with your eyes. It's not, they should do that anyway, but obviously if they're busy and stuff, sometimes they've got people that have been coming to see them for years who's chatting away or whatever, and they probably just don't need to see that. So, but if you're concerned, tell your acupuncturist that. They should be more than happy to show you the packets being opened. So most people use you can get sort of in groups of 5 basically. So you sort of open a packet, you've got to use the 5 needles, or you get single, individual, divided up. So
brilliant. I hope that's helpful, Jane. And she said it might be a silly question, but there's no such thing as a silly question here. No. Especially if you've never had acupuncture. Wonderful. Well, we've covered all the questions that have come up in the chat. If anyone is watching this on catch up, please do add your questions in. I'll make sure I check them over the next few days and just see if there's anything that we've not answered in the session. But Ian, before we finish up, was there anything sort of final you wanted to share with everyone? I know we've covered a lot of ground already.
Yeah, I would just say if you can, it's well worth a try. I'm not going to say we can't give clear answers for anyone. We can give clearer answers if somebody comes through with osteoarthritis of the knee, because that might be the 3rd person with osteoarthritis of the knee to come through that week and it's only Tuesday or something. So that's that we can give pretty good estimates of how long it's going to take, how much acupuncture you'll need. So there is an element for people with ankylosing spondylitis too, that there will be a degree of patience that obviously is going to depend on your individual condition. But generally, I think it's worth a try if you can get access to it funding-wise. And it's also worth, just for us, globally, just plug away, write to the practice manager, drop them an email, drop a line to your MP, write to the health secretary, whoever, it depends on your own kind of time and stuff. And hopefully because this is how acupuncturists become more popular. Way back, 30 years ago, 40 years ago, 50 years ago, there was a time that a GP would have been struck off the General Medical Council register for suggesting someone have acupuncture.
Gosh.
So that will be in people's living memories in the early 70s, I believe. And it was illegal in most states in America. So Nevada was the first state to legalize it. So that was until 1973. They can very precisely say that. So in that period of 50 years' time, we've come a long way to go from that to being pretty much commonplace in many American hospitals and many states, being used as part of the insurance system within Germany and also within our own NICE guidelines. But that's happened through people trying it, people getting better, people saying to their friends and relatives, it worked for me, people saying, and that's grown. In some, even though I'm the research person, it hasn't necessarily come directly from the research, it's come sort of from the people, and it will move on from the research now because that's beginning to take over more, but also from people making their individual pressures, and organizations like various charities involved, advocating for different conditions.
It all adds up, doesn't it? The strength.
It does. It all adds up, and you never know, your letter might land on the desk of a significant individual who says, yeah, let's give it a try, set up a pilot project in a particular place, they produce an audit or whatever, and then other GPs practices, oh, that's good, I want to try that too. Or your MP might be savage, trying to judge it or something. I don't know. Yeah, so yeah.
No, that sounds really, really hopeful for the future. And
yes.
Please do, everyone who's watching, just if you've had acupuncture before, keep sharing your experiences, and it's really helpful to spread the word.
Okay. All right, but other than that, thank you very much for inviting me, and I hope we can keep the conversation going.
Absolutely, yeah. Thank you so much for your time today. It's been really helpful. And we've got lots of people commenting, thank you for an interesting session. So what I'll do is, just before I finish the live stream, I'll just let our viewers know that our next session is going to be next week at 1 p.m. and we'll be talking all about winter well-being and keeping well in the coming colder months. And that's with Colin Beaver, who you may remember back in, I think it was in June this year, he spoke about summer well-being. So we're going to go for the opposite this time. So thanks again, Ian, so much. That was really helpful and really fascinating. Okay. And hopefully see everyone else next week. Thanks for watching, and thanks for sharing as well. Take care.
All right. Bye.